Hello, I'm Betsy Bakeman, Accredited Fellow in the American Academy of Cosmetic Dentistry. With me today is Trevor Langchild, Accredited Member from Toronto, Canada, Jenny Wahlberg, Accredited Member from Stillwater, Minnesota, Nelson Rigo, Accredited Member from Los Angeles, California, and Brad Jones, Accredited Fellow from Boise, Idaho. The core value of the AACD is it's about supporting each member to reach their own potential.
This whole process of being a member and going through the accreditation process, for me, has instilled a higher level of passion. I really hope that people watching this will realize that it can lead to a personal growth, an educational growth, and a self-esteem that you just unaware of when you start out this whole process.
When you're done with the process, you have even more drive and even more belief in yourself. And different dentists that I work with have great confidence in what I can bring to the table too, which is great. And it was not that way before the accreditation process.
Something that we found was through the process, we met doctors that thought like we did. We did better cases, more fun cases, more profitable cases.
I think it brings credibility, and that's something that we need because technicians quite often are afraid to tell the doctor what they really want and what they need, and so this credibility is huge.
Which other environment would you have as a lab technician being asked for my advice from a clinician? And the respect, the mutual respect and understanding of the process was awesome.
You've all become more involved in partnering in the diagnosis and the treatment planning.
Absolutely.
Interesting.
I see now that I'm much more aware of situations that could be possibly a problem. Before we even start, we hop on the phone, we communicate, and we can solve this problem before it goes all the way to the end.
Something interesting that's happened to me a lot is doctors will send models and photos and say, listen, I'd like to do, let's say, a full mouth rehab because I want to do an extreme makeover. But because they respect what we say, you can say, listen, let's treat it like this. We don't have to do all the teeth, a little bit of ortho, and then we'll maybe do 8 teeth. And we're saving a lot of enamel that we never ever thought about because we didn't have the skill set.
This whole process has given me a self-confidence to actually have my own consultation with the patient, and my clinician will explain to the patient, they're coming to see me, who I am, my credentials, and my educational path. And the patient comes to see me, and it's inspiring.
I specialize in smile design, that's all I do. I wouldn't be able to do that without those credentials. I wouldn't have this, these doctors that are all over. In order to have that kind of workflow happening, you have to have the respect from a lot of doctors who specialize in smile design as well.
Nelson, you went through the process with a dentist that was also pursuing accreditation. Tell me how that worked for you.
He taught me about tissue and things that we don't look for. At least in those days, I didn't look at that. I'd make crowns and that would be it. He said, well, no, how do these crowns play into the canvas that is the patient's soft tissue? How does that play the patient's smile and their personality and the things you never really looked at before? And so with that synergy, we just really started looking at cases a different way. And it helped me not just with my accreditation, but when a doctor called on any case, I have now a new skill set that I didn't have before. And it just makes me look like an expert, and that's always nice.
I had worked real closely with a number of dentists that had gone through accreditation and did the cases for them, which kind of inspired me, and they brought me to a meeting and just knew from that point forward that I just wanted to be part of this. I think the relationships that I've developed with clinicians and my fellow technicians, they're lifelong friendships. We continuously communicate amongst each other and talk about different ideas, different materials, and that's invaluable to me.
It's become a mastermind group where I have these technicians with me and we can call each other and say, what are you seeing? What are you finding? We share techniques. There is no competition. It's always, we're all pushing each other to be excellent. And that's something that you don't typically see.
Now, does it take a special person to go through this accreditation process, or can anyone with the motivation to do it acquire the skills and knowledge to achieve accreditation?
I think it requires being an individual that will step forward and not sit back It is all about getting out of your comfort zone and applying yourself and wanting to be greater, wanting to be better. The Academy puts a technician on a pedestal from the beginning because there's so few that are involved, and especially in the accreditation process. So you're really pointed out and you're really taken very, very good care of.
In conclusion, I'll ask each of you to summarize accreditation in one word.
From my point of view, I would say educational would be my choice of word.
Inspirational.
Motivational.
And I'd have to pick profitability.